c'est le dossier médical avec tout depuis que ça a commencé. Donc tout depuis 2018. Voilà, c'est assez dense.
3 years ago, Laure went to see her gynaecologist after having severe abdominal pain. The doctor diagnosed her with polycystic ovary syndrome, an illness which affects 10% of women and which can cause infertility.
It's a hormone imbalance. Too much male hormones in the body. In other words, too much testosterone. This also stops ovulation, so when you decide you want to have a child, it makes things very complicated. No ovulation means no fertilization.
She and her partner turned to medically assisted reproduction. After several disappointments, they were advised to try in vitro fertilization, or IVF, but at first it didn't work.
Unfortunately, there was no embryo. The fertilization failed. That was tough. It's really hard. We're trying to start a family because we don't have any children. It's also hard physically. We must undergo many tests at the hospital and have to go there very early before work, so that's not necessarily easy. The many jabs we get cause swelling, leaving marks and scars, and it's a lot of hormones flying around. For all these reasons, it's a grueling process.
The second try was fruitful, and an embryo was successfully implanted into Laure's uterus a few days before the interview. Often, infertile couples feel isolated, as though their issues were something to be ashamed of. Laure found support from the fertility charity BAMP. The NGO says infertility is far more common than most people realise.
The latest statistics we have indicate that it now concerns 1 couple out of 4. That really comes down to a lot of people. A couple is considered infertile when there's no pregnancy despite trying to have a child for a full year. The big problem is that people don't speak up about this. You won't have many people say, "We had our child thanks to IVF."
According to official figures, 1 child out of every 30 is born thanks to reproductive technologies. In other words, there's 1 child in every class. Leia is 3 and was born thanks to in vitro fertilization. Her 2 parents are infertile. Pauline, just like Laure, has polycystic ovary syndrome. Her husband Thomas has a low sperm count.
It's because the sperm count is low and they lack vigour, so there's a high risk it won't happen naturally.
And I wasn't ovulating. Ovulation tests revealed that over the span of a year, I only ovulated once. Meanwhile, Thomas had a low sperm count, so clearly it wasn't going to work out naturally.
Aligning the stars is tricky.
Because Laure and Thomas were still young, at just 29 and 31 years old, the IVF worked on the first try.
Here's the birth announcement we sent out. She was born on the 8th of August 2018. When she showed up, I completely forgot about assisted reproductive technology and all that stuff. My one and only thought was, here she is.
The couple now want to have a second child and is once again preparing to go down the IVF route. They want to speak out about their experiences to break the taboo around infertility.
For a guy, it's a bit like if one's manliness was being called into question. Being infertile is often paralleled with being impotent, but it's got nothing to do with that. It's not because you're infertile that you're impotent. It's not like you can't have good relations with your wife. Sometimes I compare it to having the flu or catching some kind of bug. You fell ill, but hey, you got treated.
Infertility being related to sexuality, it's a super taboo subject. I remember when my brother started asking me questions. How's your cycle? When are your periods? Have you ovulated? First I thought, it's crazy I'm talking about this with my brother. But then I thought it's actually very cool to be able to speak freely about such an intimate matter. And that's what's needed. People have to become aware of this.
More and more people are being impacted by infertility, often seemingly out of the blue. In France, infertility is on the increase, going up at a rate of around 0.5 percentage point each year. That increase is due to pollution in the environment and endocrine disruptors. It's also linked to other lifestyle factors such as smoking, obesity, and waiting later in life to start a family. JOΕLLE BELAISCH-ALLART is head of the gynecology department at this hospital in the Paris area.
C'est toutes les photos des petits-enfants qui sont nés avec nous, mais il y en a d'autres partout. Et c'est trop mignon. Franchement, c'est la récompense.
This reproduction specialist says young adults have very little awareness of the impact age will have on their fertility.
The drop in fertility with age is little known and sometimes dismissed by women, often those with higher education, more so than by men. Assisted reproductive technology isn't a magic spell that's going to rejuvenate ovaries. The success of our treatments declines with age.
One possible option is egg freezing. France's new bioethics law, which was approved in August, allows all women between the ages of 29 to 37 to access the treatment. That means women still in their 20s could freeze their eggs to use them years later.
Egg freezing will be allowed regardless of medical reasons. This means a woman who hasn't yet met the partner she wants to have a child with but is worried about her age and fertility will be able, once the law is passed, to get her eggs frozen. But that's no absolute guarantee. It all depends on the age when you get it done. Still, it's a major plus for women.
Infertility is becoming a public health issue. In October, the health minister started work on a list of recommendations to improve things, which are set to be published in the coming weeks. Professor SAMIR HAMAMAH is leading the project. He says far more work needs to be done around informing the public of the risks.
In
this world, there are as many infertile people as there are diabetics. While large campaigns are being funded to raise awareness of diabetes, I'm sure a bit more could be done to also raise awareness of infertility problems. When people go to see a doctor for infertility reasons, it's often pretty late. That's why we should better communicate on this, starting with schools and teenage students.
Campaigns designed to raise awareness of infertility could soon be launched, aimed squarely at younger adults. Meanwhile, for many couples, science still can't explain why they can't conceive.